Welcome to Nasdaq TradeTalks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining us for this segment, we have Aloha McBride, Global Health Leader at EY, to discuss volatility in the healthcare sector due to the recent wave of labor strikes and the ongoing clinical burnout crisis. Aloha, it's great to have you with us. Welcome to Trade Talks.
Thank you. Great to be with you.
You got it. What are the two top reasons why so many clinicians are leaving the medical field?
Absolutely. In our research, we find that a lack of autonomy and concerns around patient safety are the top two reasons. And this is really stemming from the clinical burnout. What we've seen is that many of our clinicians talk about moral injury, meaning they know the right thing to do. They want to do the right thing for their patients. But because of things outside of their control, resourcing, other issues, they're not able to provide their patients with the care that they need. And this isn't letting them live their purpose. And for this, they're considering leaving the medical field.
So then what's the disconnect between the clinician and health system perspectives?
Absolutely. So in our research, our executive teams are very focused on retaining clinicians, which they must do, focused on increasing pay, looking at different pipeline opportunities to pull more clinicians into their systems, and also ensuring they're operating at the top of their license. Very much supply side focused. When we think about what the clinicians are really talking about, they're looking at demand. They're wanting more investment in preventative care. They're really looking to have more time with their patients to ensure that their patients are going to get on the right track with the kind of care plans that they need. And they really want better staffing ratios. So making sure that I am optimized in my delivery of care, but ensuring that I'm not overburdened as well. They also are looking for different career pathways. They want to be able to grow in their career differently than, say, nurses 2 or 3 decades ago would have a different expectation.
Do you think health systems haven't embraced, let's say, digital transformation or analytics-based insights, which would make the industry more efficient, be a little bit more predictive? Are health systems doing enough to incorporate newer technologies to make it a more efficient, sustainable place for workers?
I think the short answer is they're really trying. But however, digital has been seen in the past very much as a cost center, not really as a value center for health systems. The second side of this is a lot of times these types of digital tools have not included the clinician at the table in that design process. So many times they're not really fit for purpose. And when you have that situation, you will have lower adoption. Now, I will tell you that the clinicians see huge potential in digital. It just has to be created in the right way. And I also think that when you think about what they're dealing with today, none of the clinicians we've interviewed were actually receiving those insights at the point of care through the digital tools. Sometimes they're a little clumsy, not so interoperable today, but they have potential. And I think that's the thing that we need to underline. We need to embrace those digital tools, the value that they bring, and incorporate them into our care pathways in a hybrid way, along with remote patient monitoring and virtual, as well as other digital tools that can support that clinician to patient engagement and proactive communication.
So a couple questions here. It sounds as if, as with other industries, are really looking to move towards a hybrid care model. Has this always been the case in more recent history? And or do you think what we've learned with working in hybrid models and the stress associated from the pandemic on the healthcare system, has that only exacerbated the move or the desire to move to a hybrid model?
I think we're at a point now with this shortage that we see, up until 2033, that we have to embrace digital hybrid care models. We don't really have too much of a choice. We just have to get them from being demonstrations to really full-scale enterprise implementations. And when you talk to clinicians as well as executives, I think everybody sees the promise of going down that route. They understand how virtual can be incorporated, how remote patient monitoring, even within an inpatient setting, can reduce the clinical burden. But these tools, they have to be designed with the clinician in mind, and they have to incorporate the experience of both the clinician and the patient. Meaning, I think early in the pandemic, our virtual care tools were okay. They were life-saving for sure in certain circumstances, but now that we've had time to reflect on what that virtual experience needs to look like, many health systems are taking a second look, trying to make sure that that is a natural care pathway within their enterprise.
It's interesting. I was reading in your notes that clinicians want to spend more time with the patient, and while some tasks might be getting removed, they're not getting more time. Their patient load is actually increasing when you see tasks that are being alleviated. So again, like where's the disconnect there? How does that get resolved?
Yes, it seems like over the decades, we've been so focused on optimization and really looking at patient throughput, ensuring that we're supporting access to patients, that instead of once we've saved a few minutes, instead of giving that time back to the clinician to say, okay, you need to have some autonomy, you need to decide how you're going to spend that time with your patients. Some patients may need a little bit more time. Instead, we end up just adding another patient to the roster. So at the end of the day, they don't have that autonomy, and we're increasing, the workload. Now, sometimes that's required, but I will tell you where I think we can get a lot of savings in that administrative burden is in the EMR. We know that nurses, for example, they spend 41% of their time documenting, a lot of times in the EMR, and some of which is required, but certainly with some of the new generative AI tools and natural language processing tools, I'm really hopeful that we're going to see an acceleration of these tools in the EMRs to help reduce the burden on the clinicians.
All right, Aloha, we appreciate the insight. Thanks for joining us on Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.
Thank you.